Question 181. To help prevent resident falls, the nurse aide should A. Leave residents' beds at the lowest level when care is complete. B. Tell residents to wear larger sized, loose-fitting clothing. C. Always raise sign rails when any resident is in the bed. D. Remind residents who use call lines that they need to wait patiently for staff. Answer A. Explanation. A primary safety rule in fall prevention is to always return a bed in the lowest position. Residents should be able to touch the floor with their feet so they can stand easily. Bed wheels should be locked and side rails down. Question 182. Swollen ankles and legs may be signs of A. Cardiac arrest, B. Congestive heart failure, C. Coronary artery obstruction, D. Peripheral vascular infection. Answer B. Explanation. When the heart becomes weak or has a defect, it can't pump efficiently. Because blood can't move, it starts to pull in the feet, ankles, and lower legs. This swelling is called edema. Question 183. What is a pulse oximeter used to measure? A. The amount of O2 in the blood. B. The amount of CO2 in the blood. C. The amount of CO2 in the patient's lungs. D. The amount of O2 in patient's lungs. Answer A. Explanation. A pulse oximeter is a device used to measure pulse, as well as the amount, or saturation, of oxygen in the blood. It provides a quick reading without having to do a lab test. Normal O2 saturation levels are 94 to 99%. Patients with COPD and emphysema will have levels of 90% and higher. Record the level as SpO2, which indicates that a peripheral reading was obtained. Always notify the nurse of an SpO2 of less than 90%. Question 184. The nurse asks you to change the urine drainage bag for patient with an indwelling catheter. If you aren't used how to change it, what should you do? A. Tell other nurse to do it. B. Ask the nurse to show you. C. Check the policy manual. D. Change it anyway. Answer B. Explanation. Do not attempt to do a procedure or give a treatment if you're not certain how to do it, or if you have not been trained. Tell the nurse. The nurse may show you how, supervise the procedure, or give you another task. Patient safety comes first, so ask for help if you need it. Question 185. Food moves more slowly through the digestive tract of older people. What is the common consequence? A. Bowel incontinence. B. Constipation. C. Enteric conditions. D. Diarrhea. Answer B. Explanation. Up to 50% of nursing home residents have constipation. Besides having a slower digestive process, older people often don't drink enough water or eat a balanced diet. Lack of activity can also contribute to constipation. Question 186. A patient suffering from pneumonia might exhibit symptoms such as A. Thick sputum, B. Chest pains and discomfort, C. Persistent coughing, D. All of the above. Answer D. Explanation. The signs and symptoms of pneumonia can range from mild to severe. Besides those listed, a patient may have shortness of breath, fever, sweating, and chills. The patient may have extreme fatigue, and older patients may appear confused. Question 187. Mr. Martin drank 6 ounces of coffee and 3 ounces of orange juice during breakfast. How many cubic centimeters did he drink? A. 18 cc, B. 270 cc, C. 180 cc, D. 9 cc. Answer B. Explanation. 9 ounces equals 270 cc. When converting ounces to cubic centimeters cc, remember that 1 ounce equals 30 cc. Although an ounce is slightly more, the amounts are considered to be equal by doctors and pharmacists. Also, 1 cc equals 1 millimeter. Question 188. Which of the following is an appropriate task for the nurse aide? A. Changing sterile wound dressings. B. Taking a telephone order from physician. C. Giving medications to assigned residents. D. Participating in resident care plan conferences. Answer D. Explanation. It is important for every healthcare professional to only perform tasks that are within the scope of practice. As a CNA, you are a valuable team member to contribute to a care plan conference. The other tasks are for the nurse. Question 189. What does the abbreviation BID stand for? A. 4 times a day. B. 3 times a day. C. Before dinner. D. 2 times a day. Answer D. Explanation. The term BID means twice a day. It is an abbreviation for Latin, bis in D. It is used in medicine and pharmacy and can also be written as BID or BIT. Question 190. Considering the resident's activity, which of the following sets of vital signs should be reported to the charge nurse immediately? A. After walking exercise, 98.2 degrees to 98.28. B. Resting, 98.6 degrees, 98.32. C. After eating, 97.0 degrees, 64.24. D. While watching television, 98.8 degrees, 72.14. Answer B. Explanation. The normal respiration rate for an adult at rest is between 12 and 20 breaths per minute. A rate of under 12 or over 25 breaths per minute while resting is considered abnormal. A rate of 32 is extremely high and should be reported to the nurse immediately. Thank you for watching.